Good morning, good afternoon, everybody. I'd like to welcome you to this fifth webinar on the series of webinar by ICAT on estimating the prevalence of trafficking in persons. My name is Clara Pascual, and I based in Geneva. I'm working with the Office of the High Commissioner for Human Rights, where I support the mandate of the Special Rapporteur on Trafficking in Persons, who's a member of ICAT. And before we go to our excellent speakers and their presentations, I'll just want to give a few words before on ICAT, also especially for those of you who haven't met us before or haven't heard of ICAT before. So ICAT stands for the Interagency Coordination Group Against Trafficking in Persons. ICAT is basically a policy forum made of members of the UN family and others that aims at the coordination and cooperation in preventing and combating trafficking in persons. The group operates under the continuous support of the UNODC, the UN Office on Drugs and Crimes. It operates under overall plan of action that contains or that is focusing on 6 priority areas. And one of these areas is actually building on the evidence base on trafficking in person. The group annual activities under this plan of action is shaped by its chairs and the group. And this year chairs are the International Organization for Migration and the Office of the Special Representative of the Secretary General for Violence Against Children. As part of this co-chairing and the work plan for 2023, we are focusing, among other things, in promoting data innovations and providing thematic guidance and research on trafficking in persons. And this webinar series is part of this. The webinar series are composed of 6 webinars that were planned throughout 2023. This is webinar number 5, and those webinars have ranged on things from trafficking in persons, data collection tools and data visualization, to trafficking in persons research gaps and dilemmas. And I'd like to introduce you to our first speaker. Her name is Julia Serio, and she's a research officer at UNODC Research and Trend Analysis Branch. She will introduce the concept of prevalence and the implications using this type of evidence for policy purposes. Julia, the floor is yours.
Thank you very much, Clara, and good morning, everyone. Good afternoon. So a little step back, in 2010, UNODC received a mandate through which the General Assembly asked the office to report biannually on patterns and flows of trafficking in persons. So that's where it all started. We were tasked with this mandate of trying to inform evidence-based policy for better anti-trafficking response, and to do it in a way that it's really based on the reality of trafficking. So what are the patterns in terms of victims' profiles, of offenders' profiles, the flows of transnational trafficking, transnational trafficking and victimization. This after 10 years after the entry into force of the protocol, it was a bit of a moment where member states realized that they needed good information in order to step up the fight against trafficking in persons. So that's where we started. The problem we had at the time, and that we're still facing, is that victims of trafficking are what is usually defined in research as a hard-to-reach population. It's a type of population that cannot be captured with traditional research methods. Just to make an example, we can easily know how many people go to school in a district of any given city. This is possible. We can run different types of surveys and use different types of sources. But to know how many people are victims of trafficking every day in a given location, this is still quite difficult. And for a number of reasons. It's because victims of trafficking may be secluded in hidden locations, or because they may be at plain sight, but they have no interest in being found, for instance. They are afraid of retaliation. There are no support services that they can access if they self-report to authorities, or they are a marginalized population within the country. It can also be simply that even with all the possible efforts being made by law enforcement and social services, victims are just so many and they have such different profiles that it's just hard to reach out to all of them. This is why the first solution that we found was to start by saying, okay, let's start by collecting data of undetected victims, on those that are reporting themselves to police authorities, those that are identified in criminal trials, or that are supported by social services, for instance, or NGOs. And this is how we started the Global Report on Trafficking in Persons. The last edition is the 2022 edition, and you can access it online. It's based on a yearly global data collection. So every year we send a request to member states, to UN member states, to all governments who are part of the UN, and ask them to share with us the official figures. So the figures that they record and in their administrations when it comes to victims of trafficking, of offenders that have been apprehended or convicted for crimes related to trafficking in persons. And as of now, we have a very large data set where it's possible to see, for instance, what's the profile of the victims who have been detected since 2003 in many countries around the world. But as I said, when we talk here, we're still talking about detected victims. So those victims that have been identified by law enforcement authorities or by criminal justice systems, or that are supported, in any referral mechanism that can be operational at country level. It really varies from country to country, but the idea is that we can only count what we see or what the authorities see with these methods. Nevertheless, the coverage is quite big. So as of now, we do have quite a good pictures of how many victims are identified in 145 member states. Victims identified doesn't necessarily mean victims supported. It doesn't necessarily mean that these people have received support and have, in order to be reintegrated in this society or to receive the protection that they need to avoid re-trafficking, re-victimization. But we know for sure that they've been identified. And over the year, the coverage has increased a bit counterintuitively. Our graph that show how the number of victims detected has increased over time. They are good news. They show that member states identify more and more victims among those who are affected by trafficking every day. And this has been a trend that we have recorded since 2024. Of course, our capacity to track this information has increased over time, and the capacity of member states to have better data has also improved. But overall, it's possible to see that more and more victims are identified. And that's and for instance, it was interesting to notice in 2020 during the COVID pandemic that this is not a trend that is going to continue regardless, or it's not a progress that it's inevitable. Actually, we can go back, and it's really dependent on the capacity of the state to respond, and that's why we like to present these figures as figures more on anti-trafficking rather than figures on trafficking. They show how well a country can respond to trafficking, or what's the focus of their anti-trafficking policy, and what's the capacity of the response. And there are many reasons that can be identified behind any changes in the number of victims detected. Just some of them can be changes in legislation. So suddenly the law of the country recognizes a new group as eligible for the status of victims of trafficking, or the legislation gets updated and brought in line with the trafficking protocol. And it could be just a change in the capacity to detect trafficking victims. Specialized police force, for instance, in some countries could lead to a higher detection of victims, or greater financial investments, human resource investments in victims' identification through social services and NGOs could also be behind greater numbers and greater figures. And of course, we need to consider also a change in opportunities for traffickers to operate and to abuse the position of vulnerability of certain members of the society that may be systematically put in a disadvantaged position. Just to show, one of our key statistics is about the gender profile and age profile of the victims detected. And what we have seen over the years is that this profile has changed quite a lot. So in 2004, what we were saying is that women and girls account for the vast majority of identified victims of trafficking. In 2020, this picture has a bit changed, with men being more and more identified as victims of trafficking. Of course, this just means that men are now more identified by member states, authorities, and NGOs. It does not mean that men are being more victimized and more exposed, or are more at risk of trafficking right now compared to before. Just to then really ask ourselves, how can we really know them? What's the profile of the people who are actually being victimized in this very moment, beyond what's below the eyes of the authorities? And that's where we started to work really on prevalence estimates. And the idea is to tackle the hidden figures. So to really have a look at the trafficking that takes place, but is not detected. And of course, it's a very challenging endeavor, as you know, we have specialized professionals who work every day to identify victims of trafficking. Here we're tasked with understanding what's the figure in the world at a global level. Before I start, I know my colleagues will go in depth into the research methods that we are starting to test. I'd just like to spend a few more words on why this is important, by making a fictitious example on what could happen in a made-up country that I would call utopia, where there are two institutions that are in charge of victims' identification. So let's pretend that we have law enforcement authorities and the criminal justice systems who identify victims of trafficking in a given country. In this country, because of the recent operations of the police, women and girls have been identified as victims of trafficking for the purpose of sexual exploitation, let's say. And within the criminal justice system, on the same year, there is a prosecution case. There's a case that reaches the prosecution and conviction stage about another form of exploitation for trafficking. Where actually a family was, so a group comprising of children, men and women, were identified as victims of trafficking. If we had to draw the profile of this country and their victimization profile in 2020, the answer that we will give is that the most detected of victims of trafficking in Utopia are women and girls. That's what this picture gives us, if the country were to share the data with us. Let's pretend then that in the year after, there is a new support service that's activated by the new anti-trafficking policy. And that these victim support services happen to focus on victims in the construction sector. And so suddenly there are all these men who work in construction sectors that have been identified as victims of trafficking within Utopia. What we see in 2022 is that indeed the profile of victims in the country has completely changed. We have now men and women as main victims of trafficking. The question we need to ask ourselves here is then, how do we get to see even more? So what we're looking now, and my colleagues will go more in depth about that, is that what are the methods that we can use to actually get to see and to put our lens towards those that are not identified systematically, that go beyond this radar. We're looking at UNODC at the use of three methods. MST is the multiple system estimation method. And then we also used respondent-driven sampling, which is a sort of a survey in Brazil, in the state of Pará. I have no results to present on this, so I'm going to just mention it and give the floor to my colleagues who will talk about how surveys can be used, to a manual that's been developed by UNODC on actually how to design a multiple system estimation, and some information about the study project that my colleagues will now introduce more in depth. Thank you so much for the time and attention.
Thanks so much, Julia. I'd like to introduce you to our second speaker, Gary Sayovici. He's a senior economist with the ILO, and he will present the project called STATEP that works to develop operational definitions, tools, methodologies, and uniform guidance for the measurement of trafficking in persons, forced labor, and trafficking in persons for forced labor. Gary, the floor is yours. Thank you.
Thank you, Clara. Good day, everybody. So I'm here to introduce the STATEP project. STATEP stands for Standard Tools for Analysis of Trafficking Persons. This builds on the motivation kind of that Julia just presented, but also on different things. So the project, one of the origins of it, it's the partial legal overlap between the concepts of trafficking persons and forced labor. So, I mean, as you all know, I mean, trafficking persons defined as per the Palermo Protocol has the act, means, and purpose components, while for the ILO, what forced labor is, as defined as Convention 29, the main criteria that we see there are about involuntary work and coercion. This criteria for the ILO perspective, the criteria for forced labor basically have been operationalized into a statistical definition endorsed by the International Conference of Labor Statisticians in 2018. So finally, we have guidelines on how to measure forced labor. And then if you look into the numbers we put out there with partners on the global estimates of forced labor and so on, we use these guidelines as basically the measurement framework for it. However, the same does not apply to trafficking person. There is no statistical definition at the international level. So often you would see the numbers used interchangeably in research or in policy. So, we think that the consistency in the measurement approaches basically would improve not only research. I mean, if you think, for example, you can track the evolution of the indicators. You can do more sophisticated research with impact evaluation using one of these two components as an outcome variable. But also, mostly important, I think, if you have consistent measurement in these concepts, it would improve response. There are plenty of countries where a different line ministry is in charge of forced labor than trafficking persons, and as we don't know at least the statistical overlap of the extent of these two phenomena, it's difficult to eventually harmonize areas of actuation. So the project comes in this, given this context, it's a joint project between the ILO, UNODC, and IOM at the United Nations level, and the University of Georgia. We have our colleague David presenting soon as an academic partner. This is funded by the Department of State of the United States. And basically the objective of the project is to develop and pilot survey tools aiming to identify the three concepts within the same questionnaire. So if you apply a questionnaire to, let's say, the whole population of a country, would be able to identify those who are or who were in trafficking, who are in forced labor, or maybe who were in trafficking for forced labor. In terms of scope here, and I will break down because I know for non-statisticians maybe this is a bit heavy, but basically the scope here is what we would call large-scale probabilistic general population surveys. So the idea is really we are not talking about here, although one initiative would inform model, of course, but we're not talking about surveys done on case management or with ultra-vulnerable populations, but rather if you go in Switzerland, where I live, and start doing a survey on across the whole population, we want to identify victims from that. And our second focus is on prevalence estimates. So in some sense, I mean, the sum of the hidden figure Julia mentioned in the previous presentation, plus the cases that were actually detected. For doing that, it's a very sensitive topic to doing household surveys. I mean, we build an experience from the forced labor angle and from the ILO side. But I mean, we also need to do like exhaustive testing, and we are incorporating to them something called respondent-centric design, which is a technique used by the UK Office of National Statistics, but basically focus when you develop a questionnaire on the respondents rather than focusing on the data user. So instead of thinking what variables you need to get, we also have to think about that, but we have to think about the person who is responding and how they go along the process of being interviewed about this issue. Some additional outputs of the project will be a data analysis plan, so with the criteria for indicator calculation, training materials, and last, but with a lot of importance, also ethical guidelines. It's not straightforward to do surveys on these topics. In terms of timeline, for your information, we started this year the project, and it goes until the end of 2026. Between 23 and 25, we're going to have regional consultations, both on the development of the standards and the tools themselves for surveys with national statistical offices, academia, survivor, and CSOs. The idea is that this is like a highly consultative process also to get not only the buy-in from people, but also that people can actually use it and see usefulness in whatever we develop. Between next year and 25, we will pilot the tools we develop in 2 or 3 countries to improve them. And then in 25, the idea is to submit draft guidelines on the statistical standard for global consultations. This is a process that happens within the UN Statistical Commission framework, where the idea is to discuss it for hopefully adoption in 2026. I stopped there. I mean, this was more for information, but I'm happy to reply if you have any doubts. Thank you.
Thanks so much, Gary. Now we will go into a more specific or in-practice approach. And I'd like to welcome Professor David Ockett from the University of Georgia, who is also the director of the Center on Human Trafficking Research and Outreach. Professor Ockett will discuss the work of the Prevalence Reduction Innovation Forum on building a global community of researcher learners in the science of human trafficking prevalence estimation, with a focus on documenting the robustness of the various methodological approaches in human trafficking prevalence research. David, please, the floor is yours.
So thank you so much, Clara. And before I start, I want to acknowledge also some of my collaborators in this project. I have Lydia Litraris, I think, who I saw is here, and she was a very, very competent coordinator for the brief. Of course, brief was a collaboration between other researchers whom I'm going to speak about here. And also I want to thank the US Department of State for enabling brief to take place. So basically, the Prevalence Reduction Innovation Forum was born out of a desire to really focus mostly on hotspot data as opposed to national aggregate level data that I think Julia has very competently spoken about. Yeah, so background to brief, we had 2 main aims. One was to bring together people who can help us in actually doing the work, which was to design, test, and disseminate that work. And right now we're in the process of dissemination because we are doing a special issue right now on that work. And also to document the robustness of these sampling approaches that I'm just about to speak about. And the major activities included a major conference that we had in 2020. Because of COVID, it was virtual, and we had close to 1,000 people who attended via Zoom and Facebook. Of course, the research has taken place. We also developed an indicators document. We also had a conference here in May where the teams presented their work. And right now, as I said, we have a special issue that is going on, which we hope to have out by March of next year. And of course, beyond that, we've also prepared some activities that we want to continue this work. So why prevalence data? And this is important. Of course, I don't need to sing to the choir. And there are people who argue that perhaps the money that we have should go straight into helping survivors. But I think it is not either or. I think it is both and. Yes, we need to have money going to help survivors and victims. But I think data can be very helpful in actually even providing better help. So for example, if we did data about their psychological conditions, we could identify PTSD, or we could identify suicidal ideation, or we could identify other things than just going to have wholesale interventions, because as one paper that we wrote said, one size does not fit all. So data helps us in terms of policy, of course, global macro things, but also data helps us to provide more tailored interventions to people who are in need. So I see data as helping us to move from effectiveness to efficiency. So these were our partners for PREF. We had the Freedom Fund in Brazil, Stanford in Brazil, Johns Hopkins in Pakistan, New York University was in 2 places, Costa Rica and Tanzania. The University of Chicago, NOC, was in Morocco, and the University of Massachusetts, Lowell, was in Tunisia. And those are the areas that they focused on in those countries. So one of the things that I said we developed was an indicators and definitions document. And we do have 39 indicators in that document. And then also we came up with about 12, which we considered core indicators. And these were coercive recruitment, deceptive recruitment, pay, being promised and not getting. So there are about 12, as you can see, they're all here. So we did require teams to use at least these 12 indicators, which we considered core. And of course, not all the 39. And I do have a document. If you want, the document with 39 indicators is online. If you want to see that, it's there. And actually, we are still working on this document. This is going to be one of the other outputs from PREV. So these were the thresholds because people were, as you've seen, working in different countries, different contexts. So we needed to come up with something that we could consider. So first of all, we wanted them to compare at least 2 sampling methods to estimate the prevalence of trafficking. And also we wanted them to use our thresholds from our document to measure the problem. And so basically most of us, or most of the teams focus on adults over 18. And we had threshold formulas. 1 was severe, 2 strong, 1 strong. And I have that document if you want to see that. So basically this is how we define somebody who is currently engaged in sex or labor services or engage in commercial sex or labor services at some point during the specified reference period. So threshold 1, just 1 severe indicator. And if you go back, so for example, PL3 will be down here. If you look at C, PL3 will be made to work or engage in commercial sex to repay outstanding debt or wage advance. Yeah. So basically, you'll need it. For example, if you look at DD2 will be in the full document because this only these 12 these 12 are only the core indicators, and then we have others which are considered medium and others which are considered weak. So when you see S stands for strong. So these were the only these were the strong indicators. So if you see 2, it means that it was a medium indicator, and 3 means it was a weak indicator. Okay, so basically, but these were the thresholds, and most of the teams used threshold 1 and 2, and then combine those thresholds in estimating the prevalence of trafficking. So these are the findings from the teams using threshold 1 and threshold 2. And of course, there are some that use a threshold 3. And then the overall was threshold 1 and 2 combined. So for example, in Johns Hopkins, overall prevalence using a respondent-driven sampling was 33%. But using PPS was only 18%. And for threshold 1, you can see it is slightly lower. And for threshold 2, because threshold, and for threshold 2, it is close. It's 25.5%. So basically the overall prevalence estimate is threshold 1 and 2 combined. So you can see that there are differences. The goal was to try and test. The goal was to try and validate the 2 methods. As you can see, for example, from Johns Hopkins, there's a difference in overall, of, by the different sampling techniques. We have 34% and 18%. So Morocco also, as you can see here, Morocco used RGS as well as mark recapture. You can see there's a variation, this variance also in terms of the overall and also in terms of the first threshold and the second threshold. You can see from NYU also, there's some differences here between the methods. They use PPS and LTS. And for the other teams as well, you can still see there's some variations, some not as much. So here, like for NYU, maybe the variance is not as much. This, I think, was the closest in terms of validation, actually. And also you can see UMass here also, the variations are not as much, especially of the overall. You can see there are small variations here in terms of the threshold 1, 13 to 8. And there's no difference in terms of threshold 2 alone for this. Freedom Fund was, they use was a special case, and they didn't use the thresholds, but their overall findings were 17 and about 10%, which was a great variation. So the reason why we don't have Stanford here is because Stanford is still doing the work, and they are going to present their work in January. So they had some issues and they didn't present their work. So these are some of the things that we learned. This was quite an interesting process. We learned a few things. We went very deep into the various sampling designs. The teams are diverse. There was a different focus on, TIP, sex trafficking, labor trafficking. I think the indicators document and definition document is a good document. It is still a work in progress, but I think it was a good thing that came out of that. And I think we had rigorous and robust discussions on the assumptions that the methods have. And there are sometimes great disagreements, even among the researchers, about what something like RDS was. So we might assume that everybody knows what RDS is, but even among the researchers, there was a lot of sometimes disagreements, which is a good thing. That is why there's a smile here. And so the other good things, we attempted some meta-analysis. I'm going to speak about that later. There's an attempt at generalizability. There was some technical support on NSAM and other methods. NSAM was required of all the teams at some point, but not all the teams actually applied it in a way that we could measure across teams. Also, the use of common indicators for analysis, that is the thresholds, I think was a good thing that came out of brief. So some of the lessons learned, I think we need to unify and standardize definitions, terms, and terminologies pertaining to the sampling designs used across the studies and make sure they are explicitly defined when being used for studying hidden populations. So even when people say RGS, let me give a good example. RDS did not mean the same thing across teams. When people say PPS, even that sometimes did not mean the same thing across teams. So I think standardization is a very, very big task that we need to do in the future. So the meta-analysis was a big effort, but I also think it was a stretch because we based it on many assumptions that could not be supported. So for example, if any people are using PPS, the conditions were so different in the different countries, yeah? So the assumptions like zero error, that everything is the same, I think those assumptions were violated. And so this meta-analysis is something that we really need to relook. Another recommendation is a need for constructing the sampling design and post-weighting strategies used to obtain a balanced and therefore representatively weighted sample of the study population. Also, we think we need to develop a user's manual to guide the appropriate use of the indicators, including the 2 hard thresholds approach and potentially a soft threshold approach for different target populations and different contexts, and possibly to serve as a function for estimating adult and child trafficking cases. There is also a need to examine and discuss the logistical challenges, lessons learned from the field, and space for improvement from the administered studies. Also, we think there's a need to ensure sustainability by ensuring that local researchers in developing countries can participate in a similar program in the future. So most of these studies were led by researchers from the West. The original goal was to have these studies led by researchers from those countries. But when the applications came, we realized that we really had to link these researchers from these countries with researchers from the West so as to perhaps to enhance the quality of the work. So what do we intend to do in the next 5 years? We intend to complete a set of common indicators, documents that researchers can use to identify tip victims. We also want to do just a traditional meta-analysis, whereby we go in depth into the studies instead of comparing the studies across each other. We also want to devise a series of new robust methodologies and software that are specifically tailored to the nature of human trafficking prevalence research. So for example, the RDA software that is there, we are working right now with one of our friends, to think about human trafficking specific software that can be used in our work in the future. Also, I think it is important to build a brief repository of human prevalence data and tools that can be replicated and used by users within and beyond the human trafficking community. So basically, we want people to be able also to replicate those studies, right? So all those data that I presented, all this data, ideally somebody else should try to replicate those findings because that is a good statistical practice. And, we were asked to speak about some thoughts and questions, and something that I may ask is how do we translate prevalence data into baseline data, and how can this inform interventions at the program or policy levels? I also would want us to think about the lingering issues in human trafficking prevalence research, and think of all the stakeholders, because we've had different things from different people, governments, survivors, people in programs, all of them have different thoughts about prevalence research. Even donors have different thoughts about prevalence. And also, it might be good to provide an example of an effective use of prevalence data that you're familiar with, because we've had data for a long time. Can we get good examples? And I will stop, I think, right on time.
Thank you so much, David. Thank you. I now go to our last speaker, and I'd like to introduce you to Clara Barrio. Clara is an independent researcher who recently worked on a research implementing multiple source estimation model in the autonomous region of Madrid. And she will talk about her experience, the lessons learned, and how the research results were translated into policy and responses. Clara, the floor is yours.
Thank you very much, Clara. Good morning to everyone. Thank you, Julia, Katie, and David for your enriching contributions. I now take the floor to share our experience implementing the multiple system estimation model to find out the dark figure of human trafficking victims in Madrid during the period 2015 till 2019. Now, first things first, what is the multiple system estimation, or MSE from now on, and what does it stand for? It is a method that it is used to estimate the dark figure of hard-to-find populations, such as, for example, people disappeared in wars, or in our case, victims of human trafficking. We define the dark figure of victims, in this case, as those victims that would never be registered in any list, thus remaining invisible to authorities, organizations, and societies at large. The MSE is actually an adaptation of the capture and recapture model originally used in the field of biology for the following purposes. Let's say that we want to know how many fish are in a lake, knowing that, of course, we cannot count all of them one by one. According to this model, we would go to the lake first thing in the morning, make a first fishing, capture 10 fish, mark them in blue, and return them to the lake. In the afternoon, after a long nap, we would go to a different part of the lake, conduct a second fishing, capture another 10 fish, mark them in yellow, and return them to the lake. Although this might sound simple, this simple data set treated statistically would allow us to estimate that the lake has a total population of 25 fish and a dark population of 5 fish. This is the fish that no matter how many times we go to the lake would statistically be never fished. In more technical terms, the first fishing is called capture, the second fishing is called recapture, and the fish that ended up painted in both colors are known as the overlaps. Now, these overlaps for any other statistical methodology would be a serious problem because they would be computed as duplicate records and would therefore need to be eliminated. However, the MSE relies precisely on those matching records between lists to estimate the results. Now, this apparently easy methodology when estimating fish becomes a little bit more complicated when estimating people, because among other things, we don't live captive in a closed environment. So in order to adapt to more complex populations, the MSE adapts the capture and recapture model by incorporating a third capture or list of data. Now, how did we implement this model? First, we built a sociogram. This is a tool for charting the relationships within a group. With this exercise, we were able to implement the multidisciplinary and multi-agency approach promoted by the IOM, as well as to identify key actors in the field of human trafficking who were in contact with trafficked persons, who had an active role in the anti-trafficking field, and who had different responsibilities or competencies in the area. Second, we decided what set of data we needed to implement the model, and we designed the form to collect it. We requested 2 types of variables, personal data and data related to the trafficking process. Now, you may be struck by the distinction we made between means and modes, and this is something that we introduced as a result of the interviews that we conducted with some organizations, and once we learned how they collected and stored the data. By means, for example, we understand the means set out in the Palermo Protocol, like, for example, fraud or abuse of a position of vulnerability. And by modes, we understand the specific modus operandi through which the fraud or the abuse is exercised. This is, for example, a false job offer or the lover boy method. Third, we requested data. When conducting this sociogram, we identified 14 key actors in the territory, and we finally received information from 8 of them, and we ended up with a total of 1,421 registries to work with. These 8 lists came from 5 NGOs, the Public Prosecutor's Office, the Center Against Terrorism and Organized Crime, and the Civil Guard. Fourth, we cleaned, harmonized, and analyzed data. This was a very long process, but it is an essential one. And after this process, we ended up with 4 lists and 975 registries to work with. This decrease of available data responded to various reasons. For example, some of the lists we received have had a very low number of registries and were unified into a single list because there were no overlaps or matching records amongst them. Also, other lists had to be eliminated due to missing information or poor quality data. This happened, for example, with the Public Prosecutor's Office list, which did not include the victim's birth date and therefore could not be used. And finally, it was time to make some decisions and design the algorithm because although there is a baseline model, researchers must make decisions throughout the whole process according to the available data and also according to the agreed margin of error. In our case, our research team was always guided by 2 core ideas: to always work with robust lists of data, even though that meant working with less information, and to mitigate upward estimates so the results we offered would always reflect the lowest case scenario. Now, after all this process, what results did we achieve? The overall results showed that the dark figure of trafficking victims in Madrid for the period 2015-2019 was estimated at 2,805 people. This means that for every 100 victims detected, 288 would have been outside the detection and identification process. Or said in other words, we estimated that 74% of victims would have remained invisible to organizations, authorities, and society at large. Now, when analyzing these identification ratios in terms of population groups or profiles, we also found out that for every female victim registered, there was an estimation of a dark figure of 2.5 women. For every child victim registered, we estimated a dark figure of 5.7 children, more specifically girls. And for every male victim registered, we estimated a dark figure of 9.2 men. Bearing in mind that the crime of human trafficking has been recognized in our legal system only since 2010, Spain has undertaken significant efforts to combat human trafficking in recent years. That is true. However, what is also true is that we still have room for improvement. We still need to work on victims' detection, identification, and registration process, because not only are we failing to identify the vast majority of victims, that's 74%, but we are also failing to identify certain types of exploitation and certain types of victims that are not women, adult women victims for sexual exploitation. Now, was this new knowledge of any use? Since the project was implemented in Madrid, we were called to participate in the evaluation of the strategic plan against human trafficking in the region of Madrid. Also, we could see that the law on the rights, guarantees, and comprehensive protection of children and adolescents in Madrid included children as a particularly vulnerable group, and also included the creation of a unified system of information and management on childhood to guarantee data collection, administrative coordination, and the production of official statistics. Now, at the national level, and with this I will finish, we also participated in the public citizen consultation of the comprehensive anti-trafficking draft bill. Unfortunately, this draft bill didn't make it through the necessary parliamentary process before we were called to general elections. However, the latest document that we have read includes the creation of a body with access to all available data sources and responsible for collecting reliable data, producing statistics on trafficking, with a methodology that facilitates data quality and comparability. Last but not least, the report on the impact on children of the General State Budget Bill for this year, 2023, recognized child victims of trafficking as a particularly vulnerable group, and to support this statement, it specifically referred to the overall results of the MSc implemented in this project and the specific results on children. This is all on my part. I remain at your disposal should you have any further questions, and thank you. Thank you very much.
Thanks so much, Clara. I really like that you finished the presentation with that very good news that had a very specific impact on increasing budget for vulnerabilities detected on children. That's really, really good news.
Thank you.
Actually, don't leave, because there is a question for you in the Q&A. The question is by Suzanne. As for the MSc model, which is based on identified figures, does this mean that we, due to the increase of identified male victims globally, can expect that the estimations will also show this increase of more male victims? Or can SME specify at national level that for certain forms or certain groups of victims, there is a higher dark number?
I would say it's the second scenario. Of course, the estimation depends on the available data. So yes, that would be the second scenario. If we only have information on a certain type of exploitation and on a certain type of people, we will never be able to estimate the dark figure of other types of exploitations and people. Imagine that we had no record at all on men are exploited for, I don't know, forced labor. Statistics would never allow us to carry out the estimation.
Okay, there's one more question from Suzanne. Based on the statistics available on the SME model, can you say if these are expected to be quite in line with the global ILO free IOM estimates, taking into account differences? Also, as based on these ILO estimates, we see at EU level actually a dark number of nearly 99%.
That's a very difficult question, and I don't know if maybe my other colleagues would be able to answer it better. But in my opinion, I guess 99%, or at least according to the results that we obtained, it could be a very high rate. But of course, it depends on the model, it depends on the region, and it depends on the time and the available data.
There's another question by Interpol, by Isaac Espinosa. Does the MSc take into consideration the increase of the efforts to detect trafficking victims so as not to assume that an increase in the number of detected victims does not necessarily mean an increase in the number of victims?
Not statistically, but that is why we think that this type of projects should be conducted with a multidisciplinary approach. In our case, the implementation of the MSc was part of a bigger project called Data Culture and Human Trafficking. And we had statisticians, we had engineers, we had lawyers. Myself, I'm a translator, so I always looked at definitions from a linguistic point of view. So maybe not the model itself, but my advice would be to conduct this type of research always with a multidisciplinary team.
Thanks. Actually, I mean, not a question, but one of the comments or even a question that I had throughout all your presentations is that something that we, especially when we go on country visits, observe is that there is always this darkness around numbers or around an actual picture when we're talking about traditionally or socially accepted forms of trafficking, or even among practitioners, what we call trafficking called by other names. And I also mean when Julia's presentation, but also David's presentation, I was wondering how those methods manage to overcome these socially accepted practices, and how those can be asked, or how they can be overcome either in household interviews or following your methodology.
Yes, we strengthen the MSc with other research methodologies, such as open innovation communities, focus groups, in-depth interviews. So yes, you have to in my opinion, I think that you have to always go beyond the one method that you are implementing in order to have a comprehensive view of the phenomenon that you're trying to reach, and also to complement the perspective or the main perspective that you are trying to apply to your research.
Thank you, everyone. Thanks so much, all the speakers, for these very, very good presentations. And thank you also to all participants to be here with us and to raise those very interesting questions as well. Before closing, I want to thank you as well, the ICAT, for having this webinar series. Thank you for all the ICAT members for promoting the webinar series, so more of us are here. And thank you for Notes team, technical team, especially for all your support throughout the organization of the seminars. With this, we close, and thank you very much. I wish you all a very good end of the day, and for those that start the weekend, a very nice weekend to you all.